Thousands of children and families in Marion County struggle with issues like poverty, substance abuse, or mental and emotional illness. Many local services exist to help families in crisis, but families often don't know about these services or can't get to them. Unmet needs can result in child abuse, neglect, or juvenile delinquency. The Early Intervention Planning Council, through the Marion County Commission on Youth's Early Intervention and Prevention Initiative, has created a plan to give families earlier access to services in the hopes of reducing the number of children who get abused or neglected or turn to delinquent acts. We hope you enjoy our monthly program, Our Kids, Our Families, Our Communities, and learn more about the local services here to help you.
Hello, my name is Shana Martin. I'm the director of the EIP initiative at McCoy. Thank you for tuning in to another episode of Our Kids, Our Families, Our Communities, where we focus on issues and topics relevant to the community and to families and the kids that we work with. And today we're highlighting children's health. So really looking at health from a lot of different perspectives. Physical health, but also dental health, and talking about the impacts of drugs on babies that are born exposed and addicted to drugs. So thank you all for being here today and look forward to informational packed show. We have Dr. Virginia Kane from the Marion County Health Department and Dr. John Ellis from MHS. And Heather Taylor, who's a professor at IU School of Dentistry. So I'll just allow you guys to introduce yourselves and tell us a little bit about what you do.
So I'm director of the Marion County Public Health Department, and it's such a diverse program. We're responsible for the entire health of the entire community of Indianapolis and a broad array of different areas that we focus on, whether it's we provide WIC services, women, infant, and children. We're special baby food products, for moms who may not be able to afford it. Dental services. We have a child, baby, adolescent community health center where we provide primary care services. We inspect the food that you eat. So when you're out at a restaurant, fast foods, we do all of that, and we have a strong environmental division too. So if there are a lot of rodents, you don't see any rodents walking down the streets of Indianapolis. Yours truly, and mosquito season, Unfortunately, occasionally you may still get bitten, but you call us, and we're there usually in 24, 48 hours to spray.
Okay.
So just a whole array of different things.
Okay, thank you very much. Dr. Ellis?
We appreciate it.
Yep.
Thank you.
John Ellis, I'm a pediatrician. I'm a health plan medical director at MHS, one of the state contractors for Medicaid and also for the Affordable Care products now. I'm involved at the health plan, obviously, also involved with the State Medical Association and Indianapolis Medical Society and the State Department of Health, working on the Indiana Perinatal Quality Improvement Collaborative, which works on neonatal or infant mortality in a lot of respects.
Okay. We'll learn more about
So what does MHS stand for?
Managed Health Services.
Yes, thank you.
We're MHS Indiana. There's one in Wisconsin as well.
Oh, wow. Get out of here.
All right. Heather?
And I'm Heather Taylor, and I represent the Indiana University School of Dentistry. I'm a visiting clinical assistant professor there, and I also handle public relations for our SEAL Indiana program.
Okay.
So the mission of IU School of Dentistry is to essentially, through excellence in teaching, in research, patient care, and then civic engagement, our community outreach, that we advance oral health for the community, for our Hoosiers here in the state, but then also globally too. And then our SEAL Indiana program is basically a traveling sealant program. We basically travel to essentially Title I schools and offer preventative services to children at those schools that don't have a dental home, meaning they don't have a regular dentist they see every 6 months. So we offer sealants, which is a preventative agent to prevent cavities, fluoride rinses, toothbrush pro-freeze, and oral hygiene instruction.
Okay,
It's
great.
our outreach effort.
Yep, you just visited my daughter's summer camp here
Fantastic,
very recently.
good.
So.
Yeah, we see a lot of boys and girls school clubs and summer camps. And then during the school year, we see the Title I
Okay.
schools.
Okay, great. So let's start with, I'm going to start with you because
Sure.
I think our teeth are something, and oral health is something that folks often forget about or don't think about.
Absolutely.
And a lot of parents don't know when they should start taking their children to the dentist. You know, these are baby teeth, they fall out, why do I need to worry about it? So
Right.
can you talk a little bit about when parents should start taking their kids to the dentist, how often they should go to the dentist, and expectations and all that other stuff?
Yes, absolutely. Those are really common questions, and a lot of myths are out there about when you should take your child to the dentist. And first, I think parents should realize that 1 in 5 children have untreated dental decay. That's a reported fact from the CDC. And that is just a terrible statistic, because if you think about it, childhood caries or tooth decay is entirely preventable. And it's one of our most common chronic conditions. So when you think of childhood diseases, we often think of asthma, but tooth decay is high up there as well. It's a very common disease among children, but it's entirely preventable. So you have to get ahead of it before it takes advantage of your child. And so we like to tell parents to take your child to the dentist as soon as their teeth start erupting, actually.
Okay.
Baby teeth. So at the very least, see the dentist at 1 year of age. And then follow-up care every 6 months.
Okay.
Or if needed, depending on the child's tooth development and if they have any issues.
Okay.
Yeah, the other thing that's so frightening about all of this is that you have children who are making it to 8, 9, and 10 years old who have
Exactly.
never brushed their teeth,
Exactly.
never been provided a toothbrush, and nor have they brushed their teeth. And we had a young child who had so much, what we want to call, I guess, scum, that it collected so much on their teeth that it sort of appeared greenish in color, and the person would never open their mouth, because when they did, the kids would tease her and whatever. And so it's just a wonderful habit that we need to develop with our children young about brushing their teeth.
Yeah, parents should be taking a washcloth when they're a baby and just wet washcloth, wiping the gums, wiping the teeth off, brushing with just water until the age of 2, and then after 2, supervising the child, brushing their teeth with a fluoride toothpaste. So if the child can spit, knows not to swallow, then that's when you can start using a fluoridated toothpaste.
Okay.
Our biggest problem right now is the sugar content.
I was going to
So
talk
the
about that.
sugar content is so high now in all the food products that
Exactly.
we're using, especially the sodas and the drinks, and there's a higher consumption of that with our young kids now.
Some are gummy and stick.
I was
Exactly.
going to, yeah,
Your
my
fruit snacks, which
dentist.
are huge.
Yep.
All kids are a big
Well,
fan of
and
those.
vitamins. My
The
dentist
gummy
said that,
vitamins,
yeah,
you're
because
exactly
she
right.
asked me, my son was at 2 or 3 was having some, looked like a cavity starting, and she was asking me, and I said, well, he doesn't drink a lot of juice, we don't eat a lot of candy, and she said, what about vitamins? And I said, yes, he has a gummy vitamin, every morning, typically on the way out the door after we've already brushed our teeth. And she said, don't do that.
Our
Yeah.
moms sometimes put their baby down with milk in the bottle, but milk has sugar in it, and then you end up with what we call nursing bottle syndrome, which is basically decayed front teeth on the baby. But speaking to your point about lack of oral care or
Right.
oral hygiene, children that have that sort of situation are less likely to pay attention in school. They might have depression issues because they're not able to socialize, talk. They might have difficulty eating, so it affects their nutrition. So dental care is really integral to total body health. But like you said, we often forget about the dental side of things. But parents should realize that lack of good oral hygiene can affect their school performance. They might not be able to sleep at night because they're in pain. And it leads to ER visits, hospitalizations, and even death in some cases if they don't get that untreated tooth decay taken care of. So serious.
So brushing how often, and flossing how often, and
Brushing twice a day. If parents are struggling when their child is young, we say do it before they go to bed. At least before they go to bed, we want you in there with a toothbrush. That way the plaque and the bacteria doesn't sit on their teeth overnight. And then flossing, when they're a child, they have what we call primate spacing, so they have these gaps between their teeth. So flossing, the toothbrush does an effective job when the child's 5 and under.
Okay.
But as the child gets their adult teeth that come in, they get crowding, tighter spaces, that's when mom and dad should be supervising flossing.
Okay.
So it kind of depends on the child as they mature, but if we start seeing the teeth are touching each other, we should be flossing.
Okay. Thank you.
Once a day.
That's really great information, and I think information that a lot of parents don't know and don't get and don't know where to look to find this
Right.
information, and just an assumption that they're just, like I said, they're baby teeth, or they're just teeth, they'll be
Exactly.
fine, and it's not a big deal, and it won't impact
Right, but if we don't take care of our baby teeth, the permanent teeth don't have a good environment to grow into.
Yep.
So,
The American Academy of Pediatrics recommends that the physicians do an evaluation at every visit
Okay.
for certain things, including the teeth, vision, and hearing.
Okay.
And
Excuse me.
one thing they can do is the parent can take them to the dental visit with them, even when they're little, and get them used to the atmosphere and so
that's
forth.
fantastic.
But we're also assuming that the parents are going.
Yeah.
Which,
Yeah.
if they got green teeth, they may not be going.
Right.
And doctors, physicians, they ask questions about fluoride too, which is fantastic. They sort of can ask questions about what their well water situation is, or do they get city water, which is fluoridated, questions like that, which will help the pediatrician understand where they're at dentally as well. So it's a great relationship.
The other thing you mentioned was putting the infant or young child to bed with a bottle. The other thing that leads to is ear infections, because the milk or whatever's in the bottle can go right up the eustachian tube and cause, that helps us grow. It also helps bacteria grow, and so that can be a real problem. So there's a lot of reasons not to do that.
Right.
Good. Well, thank you. So let's, Dr. Ellis, talk a little bit about, particularly with the news highlighting a lot of the heroin issues that are becoming rampant in our community, the impacts of a mother using drugs when she's pregnant.
This is a huge problem in Indiana and across the country, and the use of prescription narcotics has increased fourfold in the last 10 years, as has emergency room visits and deaths related to prescription narcotics. So anything the mom takes in, cigarette smoke, any kind of medications, alcohol, all get passed on to their fetus, and all have potential negative effects. And in most cases, it's more than potential, it's real. If the medications or other substances can be prescription, they can be non-prescription or off the street pharmaceuticals, or other things that aren't made by the pharmaceutical companies, like heroin, methamphetamine, so forth. And these can have an effect on the health of the pregnancy, the likelihood of going to, full term, and prematurity is a very serious problem. It's the leading cause of infant mortality. And the baby is in there getting all this stuff, and if it's something that they can become used to, such as narcotics or benzodiazepine, relaxing type medications, they are abruptly cut off when they are born. So we might anticipate that a large number of these newborns would have a bad reaction, just like an adult would going through withdrawal if they abruptly stop taking narcotics or benzos or other things. this results in problems that may appear very early in the first day or two, or may appear usually within 2 weeks or so, sometimes longer, depending on what the substance is.
Okay.
Methadone, for instance, kind of is longer, it stays around longer. So this results in kids being in the hospital longer, sometimes being in the newborn ICU, sometimes not eating well, and sometimes requiring medications to get them through this period until their body readjusts. And that can often take a month. So, and I think it's clear that we all feel like whatever your doctor prescribes you is good for you and won't hurt you, but any medication has side effects. And if there are medications that you need to be taking, then you need to have a conversation with the person prescribing it and or your obstetrician or family physician who's providing prenatal care to determine what's the best way to go. Stopping them abruptly is generally not a good idea. That may also precipitate labor and delivery. And it may also precipitate withdrawal in the mom or withdrawal in the baby even before they're born. So there's a lot of potential serious effects. So the approach that's recommended is to manage the situation with a health professional who is knowledgeable about the medications and the effects on pregnancy and the fetus and so forth.
Okay, so if there's moms are out there using and they want to stop because they find out they're pregnant, they should do that in consultation with their physician and
Correct.
not
They
just
should definitely not
cold turkey it
stop.
because that can have impacts on
Right.
them, but then also the baby.
Right.
Okay.
If they want to stop something, they could stop cigarette smoking and they could stop alcohol, which are by far the biggest problems in terms of effects on pregnancy and effects on the infant.
Okay.
Many of these medications, and particularly alcohol and also tobacco, can have long-term effects on a child, and they might not even be evident until they are preschoolers or in school. Many of the problems we're seeing today may well be related to these kind of things. There's plenty of other opportunities for environmental toxicologic exposures, cleaning supplies and other things that can affect the mom and affect the fetus as well.
Okay.
So the best thing to do is remain calm and talk to your physician about how to go from here forward and stopping something, even though you see on TV like some medications are a problem, potential for birth defects. Don't stop, call your doctor.
Call your doctor, okay. Dr. Kane, just thoughts about generally, since you cover many topics and have lots of focus when it comes to children and health. We don't have anybody here as an expert to talk about vision, but I know the health department does provide some vision screening and vision services. Would you?
So I think it's so important that every parent have their child screened for vision. And a lot of times, especially if you have your child that's having any difficulties in school or appears to have any learning disabilities, it could also be contributed to they may have some impaired vision and may require glasses, and you just all of a sudden, I don't understand why my child can't seem to read or can't learn, so they really need to get themselves checked out. The other thing is there's some other conditions that's associated a little bit with vision, like you may have a child that's dyslexic, who they see everything in print in reverse. So it takes an extensive amount of time in terms of those brain cells to reflect what's on that print. So it's a little bit slower for them to comprehend that text. So really get their vision checked. And the problem related to this is a child, it could be any year that their vision becomes impaired. They may be in the 4th grade, 6th grade, or a little bit older. So that's really, really critical. There are some genetic conditions that can occur in families, such as glaucoma. And we can see glaucoma as early as in your teenage years. Okay. And so that's the kind of thing that you might not be aware that you have a problem, because you can see everything clearly, but your peripheral vision field, you can't see as well. And you don't know, like, I can see something out of the corner of my eye, but the glaucoma, as pressure builds up in the eye, you slowly lose that circle of vision, and you don't know it until maybe you have someone driving and they have an accident and they didn't understand why they didn't see that car that just popped up all of a sudden out of the corner of their eye because they're losing their peripheral vision. So even something such as that, when you go to, whether it's an optometrist or an ophthalmologist, they usually check for the pressures within your eyes as well.
Okay.
So, kids that are having problems in school,
Mm-hmm.
The one thing to start with is to have them checked out by their physician,
Yes, that's good.
and to make sure that there's no evidence of illness or disease going on. And vision and hearing are both they're not necessarily obvious. So the only way to know for sure is to have it actually formally tested. And so that can be, both those can be done in a physician's office to a certain level.
Okay.
But but going to an optometrist and an ophthalmologist is also a really good idea. And when I was seeing patients, any question, send them to the expert.
Which I think is the key to having a pediatrician, because that pediatrician can be a resource for a lot of different things, and I find that too, that I don't know where to start. If I need to find a dentist or an eye doctor, do I just open the phone book? Do I just get on the internet? So being able to have a pediatrician that you've established a relationship with, that I can then say, okay, if this is an issue or a challenge, or I'm having a concern, who do you recommend, or can you give me a list of folks, A, that are in the network, which is always nice to know, but then B, those pediatricians have established relationships as well, and that's always really helpful, I have found as a parent, to not have to do that on my own.
And then other ones, family practitioners can also see children, so a different array of providers will have that expertise as well.
Right. I think they generally adopt the same preventive health guidelines. They're kind of national U.S. preventive health services
yes,
guidelines.
and so there's some great guidelines out there that talks about at certain ages of your, from your baby, making sure they got the proper immunizations that they need, because you can have some life-threatening illnesses, Influenza, the flu, can kill young children, and it's important that they get immunized at 6 months. We had the big outbreak with the measles. We actually had a child die. No, I don't think it was a child that died, but we had someone just recently died from measles, and so, it can be spread to adults from your children. And so it's so critical that all of our children are immunized, because unfortunately we have some kids that may have a malignancy or cancer or some other condition where it's contraindicated for them to get a vaccine. So when they're in that classroom, they have to know that they're not vulnerable or susceptible to getting another condition from another child who's not immunized, such as chickenpox, could kill someone if they're immunocompromised.
Yeah, there's a lot of really bad information on the internet that is strongly presented. It's just wrong.
Okay.
And one of the problems is that the program of immunization in the U.S. and around the world has been basically pretty successful. So things that our parents or our grandparents would have immediately said, yeah, do whatever you need to do to not get this, nobody's seen it lately.
Yeah.
And young parents definitely haven't seen a lot of these things, such as measles and tetanus.
You can get meningitis, you know, believe it or not, from measles. You can even get loss of hearing from measles. So something that is so simple and so preventable. 1 out of 1,000 kids who have measles will get pneumonia, which is life-threatening. So it's just some scary things, and you never want your child to have brain damage as a result of an illness.
So the focus of the show and all the episodes I have is always about prevention, and you guys have talked about that a lot. Prevention, prevention, prevention. I would say 90% or more of the health things, issues and challenges that we have can be prevented by having a medical home, a doctor that you can go to and talk to, and you see at least once a year. By having a dentist.
You know what? There's something called well child checks, so they're actually seen more frequently than sometimes just once a year. So
Yeah,
there's
for
a
the-
Yes,
there's
so
a
for the first
particular
kid. Yes,
schedule.
you're right.
So that's why it's really important as you're emphasizing. And listen, we have some great doctors out here in private practice. We have some wonderful community health centers that you can go that reside in your neighborhood, and so
That take all, I mean, now we've got all kind of different insurances.
Right,
You've got
right.
Medicaid, you've got the Healthy Indiana plan, you've got the Affordable Care Act. I mean, there's just, and there's navigators everywhere. The Health Department, Eskenazi.
right. So if you
I
don't
mean,
even have insurance,
you
we
can-
still
and
have
can be
care
served.
for you,
Yes.
and you can be served. So we're fortunate. We're one of those states that have expanded our insurance, so we have a whole host more folks having greater access to care.
Yes, so don't let the lack of insurance be a barrier, is what we're saying. Prevention is
Sign
very
up for
important.
that HIP 2 plan
So
now.
yes, so
Right.
there are, once you get
no
in
excuse.
there,
And
walk
then
in
the other thing
door
I have to say, and it may be tacky to say, but hey, Black Expo is happening this weekend.
yes,
All those free health screenings that are out there, please come and get those free screenings. You know, it's $1,000 worth of screenings, and there should be no excuse. You don't have any money, you don't have any insurance, or you just don't feel like going to your doctor's office. Come and have a little fun, get educated about health, okay, and get screened at the same time.
That's the beauty of it. It's a wonderful event.
Yes.
It's a lot of fun. There's a lot of things to be gained from it,
Right,
including
right.
preventive services.
And then, whether it's the television networks, different hospitals are providing free screening and partnering with folks. Attend those health fairs.
yes.
They're just wonderful. Churches are giving health fairs. Different entities are giving health fairs. You get some wonderful information. And then I have to encourage everybody, families, walk, walk, walk. Get that physical activity. Start walking as a family. Okay, start them early.
Yep.
Yeah,
I
that's
agree,
one of
100%.
the least expensive forms of
Yes,
exercise,
yes.
and it really is
Right.
effective.
Yes.
Exactly.
I'm a runner, so all I need is a pair of tennis shoes, and I
Yeah.
can do it anywhere I go. So,
But some
walking is
folks are
good.
not going to be able to be runners.
No.
But most
walking,
can be walkers.
Yes.
Even if it's just down to the corner and back for starters.
To start, you got to start somewhere.
Yeah.
then-
And and for those who are old enough to bicycle, teach them safety tips and make sure they're wearing helmets when they ride their bikes.
Okay, well, we got to wrap things up. I think we could probably go on forever and ever and talk about children's health and prevention and the importance of it. Just quickly, though, how do folks find you? How do they get to you? How do they find you?
Absolutely. The IU School of Dentistry has several numbers. Pediatric Dental Clinic is 317-274-8111. If they want their school to become involved in our Sealant program, our Seal Indiana program, they can contact us at iusdseal@iud.edu.
Okay.
So,
And terrific resource and a lot of very enthusiastic professionals.
we love kids. And we have a bunch of adult services too, so we're
Okay.
definitely family oriented. And we're actually working with Marion County right now
I was
down
just
at the
going
Black
to
Expo.
the words out of my mouth. I was going to say
That's
we
right.
partner greatly
Yes,
with
we do. We partner with
IU
them
School
all
of
the time.
Dentistry.
Okay.
So because we're just about promoting oral health, and that's our goal. So thank you.
And how do folks find you, Dr. Ellis?
Well,
MHS?
MHS is one of the state contractors for Medicaid services.
Okay.
So Hoosier Healthwise, HIP, Hoosier Care Connect, all are provided through MHS.
Okay.
And also the Affordable Care Act. Our plan is Ambetter.
Okay.
The other healthcare entities also, there's 3 of us, also have, similar type services. So you can enroll online,
Okay.
or you can enroll at various places around the community, including some hospitals, some health centers.
Okay.
But get out there and investigate it.
Yep.
And there are people out there that can help find it.
So,
Health
hey,
Department?
our number's 221-2000.
Okay.
We have like about 8 dental clinics too
Okay.
that we provide, and we do dental sealants with the schools. So call us, 317 area code 221-2000, and just a whole array of different services. If you need any primary care services, just call us.
Okay.
We're also affiliated with Ashkenazi Health.
Okay.
So for adults, we take from babies up to, I believe, the age of 25 years of age
Okay.
for our health department services. But our sister organization, Ashkenazi, all ages. So
Okay.
We got a phone number too. I believe it's 877 MHS 4U.
Okay.
So
I'm impressed
Okay.
with you guys now. Get out of here. Get out of here.
Thank you guys very much. Appreciate you all being here and sharing all this wonderful information. Thank you for tuning in to another episode of Our Kids, Our Families, Our Communities. Look forward to continuing to bring resources to your attention about all the ways that we can prevent and keep kids safe and happy and healthy in our communities. Thank you very much for tuning in, and see you again next time.